Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Mwaka. First, the highlights. France donates over 500,000 doses of Oxford AstraZeneca COVID-19 vaccines to Nigeria. Diplomatic community scores Lagos high in COVID-19 response. And Victoria in Australia sees highest number of new COVID-19 cases since the beginning of the pandemic. Nigeria has recorded 290 new COVID-19 cases and 2 deaths, according to the Nigeria Center for Disease Control, NCDC. The 290 cases were recorded in 15 states. This now brings the number of cases recorded in the country to over 207,000. Here's a look at the virus update.
290 more persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 14 states and the FCT. This figure shows a drop by 7 cases from the figures reported earlier. The FCT recorded the highest number of infections with 127 cases. Kaduna had 28, Delta recorded 18, Kwara 17, and Plateau 13. In Zamfara State, there were 10 cases, while Rivers reported 8. Imo had 6, Ekiti 5, and Nasarawa 4. Edo and Ondo had 3 cases each, while Akwa Ibom had 2 and Oyo 1. Sokoto did not record any case. Nigeria now has a total of 207,210 confirmed cases. 145 patients were discharged in the last 24 hours, increasing the total number of recoveries to 194,796. 2 deaths from complications have been reported in the last 24 hours, raising the fatality toll to 2,742. Currently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested. The latest post by the National Primary Healthcare Development Agency shows that over 5 million people have received a first dose of the vaccine, and more than 2.2 million have got a second dose. In Africa, there are more than 8.3 million confirmed cases, and over 213,000 deaths have been recorded across countries on the continent. Globally, there are more than 236 million confirmed cases, while deaths are over 4.8 million.
Nigeria's quick intervention measures at tackling the COVID-19 pandemic prevented the doomsday prediction on the continent. This is according to the France ambassador to Nigeria, Jérôme Pesquier, at the donation of 500,000 doses of AstraZeneca vaccines to Nigeria. Mr. Pesquier adds that Nigeria would not be barred access to the country if they can show proof of being vaccinated.
Is a donation by the French government through COVAX of 500,000 doses of AstraZeneca vaccine, 500,000 doses, which is a very significant quantity of vaccine for Nigeria. We are very much aware, my president is very much aware of the necessity to make vaccine available to everyone all over the world. For the time being, there have been a big discrepancy between vaccination in the northern countries and vaccination in countries like Africa. Of course, in Africa, you have been dealing very well with the pandemic. If you remember what was said 2 years ago, 18 months ago, everybody was announcing a big catastrophe in Africa, and it didn't happen. It didn't happen because you reacted very well, because you have a very good system. And I think we can really praise you for the action of the President Task Force, for the action of all the institutes involved, and of course of NPHCDA. And on the long term, vaccination is essential if you want to be completely rid of this awful disease. And this is why we are happy to contribute today to this program of vaccination here in Nigeria, which is going pretty well, I understand, but it needs to be developed, and really I can only join what has been said about encouraging everyone here to be vaccinated.
And staying with members of the diplomatic community in Lagos, credit has been given to the Lagos state government on its COVID-19 response and management in curtailing the deadly virus. The team who visited the infectious disease hospital and biosecurity facility in Yaba commended the Deputy Incident Commander, Professor Akin Abayomi, for putting up a command structure and emergency operations center to mitigate the scourge of COVID-19. The Consul General of France in Nigeria, Laurence Montmiron, says they are impressed with the facilities put in place by the state government and will continue to support Lagos and the entire country to win the war against the global pandemic.
That Lagos State has done a lot, but it is one thing to read from it and to see it on media reports, and it's another thing to come and see on the spot what is happening here. Many of us within the diplomatic communities and countries have cooperations with Lagos State. We don't have a direct cooperation with Lagos State on this, but our French companies do. And for instance, Commissioner for Health was just recalling that our company, French company Total, has financed the oxygen producing unit. So this is just one example, and I could cite many others of French companies who chose to stay during the pandemic and to help the Lagosians as much as they could on many produces which were useful for the fight against COVID. And it's important to anticipate, to use the tools that we have, such as vaccines. And yes, I think Lagos State has done a lot and continues to take measures for now and for the future. So that's a good thing.
And to Benin City, Edo State, Nigeria, where vaccination for COVID-19 continues at the center at New Benin, Benin City. The head of the vaccination team says they are administering both the first and second doses. She says the vaccination vials that were open in the morning have been used up already, and there are 12 doses in each vial. They cannot open any of the vials until they're sure they can use up all of them, which is why they told prospective vaccinees to come in the morning for vaccination.
I came for the immunization exercise, maybe for the vaccination. But immediately we came here now, they told us that we should come for tomorrow morning for the vaccination, which is necessary for everyone to take it. By the grace of God, tomorrow I will come, I and my brother, to take my own vaccination.
People are really turning up, but there is somebody that just came now. We have already exhausted about 2 vials of the vaccine, but he just came. He's the only one now available. We cannot open the vaccine now for only one because the number of doses in the vaccine is about 10. So if we open the vaccine now for only him, the 9 will be a wastage. So we don't allow that. So we now ask the man to come tomorrow morning to come and take his vaccine.
Due to the emergence of more transmissible variants of the SARS-CoV-2 virus, it will be necessary to strengthen and maintain response measures to avoid further rises in mortality, even in the context of the rapid prioritized vaccination program. Delays in vaccine procurement, distribution and administration also means that non-pharmaceutical measures must be held in place for longer. Well, Dr. Adonyo Dubanjo, a public health physician, joins us now virtually on the program for more on this and other situations. Thanks for joining us on the program.
It's a pleasure. Thank you for having me.
All right, Doctor, I'd like to begin with, how reactions are trailing the historic announcement of children to be vaccinated against malaria using the new RTSS. What's your take? And this is following WHO's recommendation.
Well, it's good. It's good that we finally have some kind of progress in that area. Attempts to develop the malaria vaccine have been on for many years. So when you have a result like that, you want to celebrate it. But it's important to point out that it's not the only thing, So this is not like saying malaria is over, we have a vaccine. No. This is one of the things that can and would be used, to combat malaria. However, we must also note that right now, this candidate vaccine that we have only reduces severe malaria, doesn't stop malaria infections completely. So it's still important to put in all the other control measures. The vaccine also tends to wane over time. So we must continue the things we know to do, to use the insecticide bed nets and all that. And then secondly, it's important for the countries to determine the cost effectiveness of introducing this vaccine. It's not going to be an easy vaccine to use. It's multiple dosaging, so you have to take several times, about 4 times each child. So all of that presents some logistical challenges if you were to introduce it. So WHO's approval is to say we think it's good enough. It's now up to every country to determine whether they think it's cost effective to use it.
And that bit of warning also, with this vaccines also is what we hear with COVID-19 and the vaccines. But are you in any way concerned that this new malaria vaccine will suffer the fate of COVID-19 vaccines, seeing how hesitancy about the vaccination is evident in many countries?
Well, I think that's why WHO wanted to make a point of mentioning African scientists working on the vaccine, on the malaria vaccine. However, that would not be enough by itself. It's important to realize that everything we do, and I'm happy you mentioned the COVID-19 vaccination and hesitancy in relation to this, because one of the warnings that I have particularly in the area of evidence-informed policy making is that what you do with the COVID-19 vaccine might eventually affect every other intervention you have with vaccinations, for instance, even with the new malaria vaccine. So there is a good chance that if we get it right, if we just mandate vaccinations and all of that for COVID-19, tomorrow again, people might say, you know what, we think something is going on here. That's why they forced us to take that. Maybe we shouldn't take this. So we must be careful about our policies, and we must ensure that we engage people. If we engage people right and let them see the benefits of vaccination, I think that they will make informed choices. The truth of the matter is that as we speak on the TV, a lot of people in the rural areas are not going to see this. They are not going to hear the things that we say. So we need to engage the community structures in order to reach the people, listen to their concerns, answer their questions, and I think most of them will agree to, to these public health measures.
Do you think, finally, that an integrated response is also one way to go about this?
Well, we absolutely have no choice. If you are going to be able to sustain anything, you have to think integration. Because you can imagine that we are giving all the other vaccinations, childhood vaccinations, we're giving COVID-19 vaccination. Then you want to start giving malaria, for instance. It won't happen tomorrow, not immediately. But let's say when it's ready, you want to start giving 4 shots of vaccines for malaria also. You have to think of how to do all of them synchronously, such that you don't waste resources, you don't duplicate effort. Otherwise, it's going to be a big problem and it's going to be unsustainable. So we must integrate.
All right, we appreciate your time on the program. We'd like to thank you, Dr. Doyin Odubanjo, public health physician. Thank you for joining us on the program.
Thank you very much.
Well, still to come, Germany recommends COVID-19 vaccine booster shots for people older than 70. Please stay with us. Welcome back. South Africa's vaccine certificate portal became live today, and more than 300,000 certificates were downloaded within the first hour. But shortly after the launch, users were taking to social media complaining that the website was timing out, and Department of Health said that this was because of a very high volume of users on the site, and it was confident that this would soon be sorted out. At the launch this morning, Health Minister Dr. Joe Fala, joined by health department officials, gave an update on government's management of the COVID-19 pandemic, as well as South Africa's coronavirus immunization program.
We're also presently happy yesterday. We're very pleased when the UK government announced that it has taken our country off from the red list, meaning more easy travel between people from South Africa and the United Kingdom. But even more exciting for us was the announcement by the UK that they will be recognizing this certificate, which we are launching this morning. So I'm sure many people who have been waiting for business trips, to visit family and friends, to go on study in the UK, will now know that they can do so without having to need to do a 10-day quarantine when they arrive in London and other UK destinations. We call on all South Africans and other nationals in our country to come forward and be vaccinated. We have a window of opportunity now, while infection rates are low, to protect ourselves before the expected fourth wave later this year.
And Germany's vaccination authority, STIKO, recommended COVID-19 vaccine booster shots for people older than 70. All residents of care homes, as well as workers who come into direct contact with them, should also be offered a third vaccine dose, according to the body. The same was also recommended for medical workers in direct contact with patients. STIKO gave its recommendation on the grounds that vaccine protection declines over time, particularly in terms of preventing asymptomatic and mild infections. Meanwhile, Europe is racing to avoid a winter wave of coronavirus. Germany is also trying to make getting jabbed as simple as possible to encourage around a third of the population who haven't been vaccinated to do so. Rob Watts, Deutsche Welle correspondent, joins us now from Berlin for more. Hi, Rob. With the weather turning colder, how are European countries hoping to avoid another spike in coronavirus cases?
Well, with such a high proportion of Europeans already being fully vaccinated, going into the colder months, the focus is very much shifting to booster shots. We've already got booster campaigns being carried out in countries like here in Germany, but also in France, in Italy, in the United Kingdom. But the number of countries where that's happening is likely to go up after an announcement this week from the European Medicines Agency, which is the medical regulator for the European Union, which has said that it's approved the BioNTech-Pfizer vaccine as a booster jab. It's recommending it's given to people who had their second vaccination more than 6 months ago, or if it's someone who is immunodeficient, so has an increased risk of getting a coronavirus, then they should be getting a booster as soon as 28 days after their second jab. Now, this is a controversial policy. The World Health Organization has made quite clear that it doesn't want to see mass booster campaigns in developing nations, as long as there are billions of people around the world who haven't had the opportunity to get their first vaccine. It wants to see those doses going to developed nations instead.
Indeed, Rob, and vaccinations, this is coming to Germany, they appear to have slowed to a near stop. Have enough people been jabbed?
Well, we had an unusual announcement yesterday from the health secretary here, Jens Spahn, that millions more Germans have been vaccinated against coronavirus than had previously been thought. As many as 3.5 million more. That's a good 4% of the population. It seems they've fallen through the cracks when it's come to, for example, mass vaccination campaigns by companies or mobile vaccination clinics have not properly been recording or reporting all of the people who've been through their doors. That does not take Germany up, nevertheless, to the 75% target that it has for the proportion of the population that it wants to have been vaccinated by winter, but it does take it to around the 70% mark, so it's getting a lot closer to that. In order to get that extra quarter of the population to get vaccinated, the German government is applying a couple of tactics. It's trying to make it easy to get vaccinated, but it's also trying to make it inconvenient to not be vaccinated.
That's very interesting, Rob. Finally, why have Sweden and Denmark decided to stop immunizing young people? And this is with the Moderna vaccine.
Well, this follows a study by the Nordic nations, Denmark, Norway, Sweden and Finland. They haven't published wider the results of this study, but they say that it suggests that the Moderna vaccine gives younger people a raised risk of getting a heart inflammation condition known as myocarditis, which in most cases goes away without any permanent damage, but in extreme cases can result in stroke and heart attack. So Denmark and Sweden have said they're going to stop giving the Moderna vaccine as a result of this study to young people. Finland has said that it's going to stop giving it to men under the age of 30 because the study apparently suggests that the risk is raised in men rather than in women.
All right, Rob Watts there, Deutsche Welle correspondent from Berlin with the latest. Many thanks. And let's go over to Australia. Victoria State has reported a record number of COVID-19 cases. It was the 9th consecutive day Australia's second most populous state reported more than 1,000 cases, with active infections soaring to 16,823. The deaths brought Victoria's toll from an outbreak of the Delta variant that began in early August to 75. Here's more on the global update.
Australia's Victoria State has seen a record 1,838 new cases, the highest number of any state in the country since the pandemic began, exceeding the previous high of 1,763 set 3 days earlier. There were also 5 new deaths over the past 24 hours. Health experts have warned that the state's peak is still to come. However, the state is still on track to reach the vaccination targets needed in order to lift restrictions. Meanwhile, still in Australia, tents have been set up outside many Melbourne hospitals, and the Australian Defence Force has been called in to assist paramedics as the hospital system comes under strain from the worsening outbreak. Russia has reported 936 coronavirus-related deaths, the largest single-day death toll it has recorded since the pandemic began. The government's coronavirus task force also says it has recorded 27,246 new cases in the last 24 hours, a slight decrease from 27,550 cases a day earlier. In a conditional approval, Malaysia has given the green light to the use of the BioNTech Pfizer coronavirus vaccine's booster shot. The country says the jab will be used only for adults aged 18 and above, at least 6 months after they've received their second dose.
To welcome President Joe Biden.
And finally, U.S. President Joe Biden has advocated for COVID-19 vaccine mandates to force roughly 67 million unvaccinated Americans to get the jab.
The fact is, this has been a pandemic of the unvaccinated. Unvaccinated. The unvaccinated overcrowd our hospitals, overrunning emergency rooms and intensive care units. The unvaccinated patients are leaving no room for someone with a heart attack or in need of a cancer operation, and so much more because they can't get into the ICU, they can't get into the operating rooms. The unvaccinated also put our economy at risk because people are reluctant to go out. And think about this.
Biden last month ordered all federal workers and contractors to be vaccinated, with few exceptions, and for private employers with 100 or more workers to require employees to be vaccinated or get tested for the coronavirus weekly.
Well, they say fresh air can help reduce the spread of COVID-19. If you're meeting friends, head outside to help drive the virus away. Continue to take responsibility. You can take a look at our website. It's channelstv.com. You can find our breaking stories and also a better understanding of the pandemic. The latest stories there as well. It's at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.